Hello and welcome to the Swine Disease Reporting System. This is the report number 61, where we're going to cover the findings from the previous month, the month of February from the SDRS. My name is Edson Magalhães here at the SDRS studio.
Hi, I'm Giovanni Trevisan with the SDRS.
Hi, my name is Guilherme, also at SDRS.
Hello, Daniel Linhares with the SDRS team.
So as I mentioned, today we're going to cover the findings from the month of February from the SDRS. So we're going to do a brief summary on it. And after that, we're going to have a special discussion with our invited guest here. We invited Dr. Rebecca Robbins. So we have the pleasure to have her here today at the SDRS podcast. Dr. Robbins is a health assurance veterinarian for PIC North America, and she got her DVM and PhD at North Carolina State University. She has large experiences in swine population medicine, having served in leadership positions at Seaboard Foods and Texas A&M Veterinary Diagnostic Laboratory. Dr. Robbins, thank you for accepting our invitation and welcome to the SDRS podcast.
Pleasure is all mine. Thank you guys for having me.
Thank you for coming to the SDRS, Dr. Robbins. So Guilherme, let's start to have the fun here. What's the major finding from the SDRS during the month of February?
Well, let's start for the first page of the report for the PRRS virus, that we are having an overall positivity below the expected for this pathogen in the month of February. What is a good news, but when we move to a regional level, we are having an increased activity in Kansas and Ohio when you compare with the specific state baseline of these two states, which means that we are having an increased percentage of positive submissions coming from these states. And also looking to the age category, we are having an increased number of percentage of positive submissions coming from the Missouri state compared with the specific baseline that we are going to explain more when we move right now to the sequencing part of the PRRS that we also keep track in the SDRS, that the L1C variant continues to spread among the country, and mainly to the eastern states that we start to have detections right now in Indiana, Ohio, Tennessee, and also Pennsylvania. That's raising a concern in states, for example, like North Carolina, that never detected the strain before, but now is getting surrounded by states with positive cases. But when we talk about the overall situation of the L1C variant, we still have most of the concentration of these detections coming from the Midwest. And for example, that's why we are having increased activity in Missouri, that we are having the highest number of detection coming from this state in 2023, with 140 strains detected coming from this state, followed by Iowa and Minnesota. And there are the top 3 states that are having detection of L1C variant.
Great highlights, Guilherme. So moving east, well, still PRRS, L1C variant still seems like still be an emerging animal health threat. And even though it was concentrated here in the Midwest, now it's moving east. So, Dr. Robbins, what are your thoughts about this? What may cause this strain to be disseminated through the production systems? And is there something that we can do to prevent this spread in the east region of the country?
Yeah, I think that's a great question, because it's a nice time to really highlight for people to remember to investigate their epidemiologic links. So things like cull markets, slaughter plants, any points of aggregation, sharing of equipment, and infrastructures, pumping equipment, and our transportation fleet has gotten a lot of emphasis lately. And so I think we've got to continue to really I don't think we have to necessarily beef up our biosecurity, but we need to make sure that it's being implemented. And so I think getting out there, and it's a great time to go and ask questions. It is unexpected that it would be moving east, because the large volume of pigs moves the opposite direction. So again, that's why I emphasize really having people go and look for what might even be unexpected epidemiologic links. And so asking those questions, getting out and talking with their contractors and support staff about the potential for those types of cross-contamination.
Some opportunity for some outbreak investigations in those unexpected sites showing a positive, right? And further reveal those epidemiologic links. It's a good idea.
So basically, don't need to reinvent the wheel, but keep working on the things that you have and be sure that your production system is following what you have worked in past as standard procedures for controlled dissemination of agents?
Absolutely. To Daniel's point, those outbreak investigations that I've been involved in, and this is just a general comment to any disease outbreak investigation. Oftentimes, I find that it's not a change or a lack, a change in something or a necessary need to add something. Is to go out and continue to implement at a very high level on a continuous basis the things that we've agreed to do on the farms.
Great. Guilherme, what do you have for enteric coronavirus?
Well, for enteric coronavirus, we also have good news regarding the detection because PED and Delta coronavirus are both WIFI inspected for the month of February. And another good news is about TGE that is close to completing 2 years without any detection. In the end of March, we are going to complete this date of not even a single positive detection in these 24 months that we are keeping track of these pathogens specifically. And it's important to mention that it's not a matter of testing because we continue to test a lot for TGE. So we had 70,000 cases that were tested in the 5 VDLs that are enrolled in the SDRS project. And this is over 260,000 samples that were tested. And even though with this amount of the testing that we are doing, we didn't have any detection of TGE.
Yeah, Dr. Robbins, on that what Guilherme just mentioned, so a lot of number of cases being tested, but they all negative for TGE. Do you see there's opportunity here for, if probably TGE circulating here in a very low prevalence in the US, do you see an opportunity for eradicating this virus from the swine industry? And if so, opportunity also for other enteric coronavirus such as PD or Delta coronavirus?
Yeah, there's so for TGE, I think you're probably right. I think large commercial systems are probably free. Small holders, maybe like we talked about earlier, some of those aggregation points where we don't do the same level of intensive and continuous monitoring are probably a wild card. You know, really to say we're free, we probably have to do some level of serologic testing. Is it worth it? I don't know. For the industry, it would certainly be a feather in the cap, though. But the real, 800-pound gorilla is our PED and our Delta that we continue to battle season after season, and recently been a little bit worse. And so likely, I think there's still reservoirs out there that we haven't really ID'd through our robust, we've got robust testing at the sow farms in our gilt multiplication. But when we get out to our grow finish sites, yet again, we see that there's some holes there, and we could probably do a little bit better. I find that those sites could be, as a whole, could be subclinical as well. It can be very hard to detect in some of these large finishing populations, again, where we don't have the same robust surveillance testing plans in place. So I think that that's an area that if we're going to make a big push, published a paper, I guess it's been a couple years ago now, where we did that in the system at Seaboard, and that made a big difference. You had to know where the disease was before you were going to actually make effective changes with it. And so I think that going back and really evaluating the value of eradication within the systems and our industry, and then looking to figure out where it is, and then we can, I think, be a little more laser focused about how to go about elimination.
Mm-hmm.
Could be a fun summer project for a student to go and sample those sub-sampled areas, right? Under sample areas, like you said, the holding stations and some other points of concentration to kind of understand virus activity, and perhaps some antibody testing to kind of better understand the TG's true status.
Absolutely. And at the same time, you can look at all the SCCDs, and the great thing is you guys have worked on the report, so now we can see at the state level, so we're not just having to have this huge shotgun approach. Again, we can be a little more targeted with our testing and where we're seeing the areas and see if that aligns with where our large areas of small holdings of pigs or our third-party aggregating, coal market slaughter plants, et cetera, which I think in my experience have oftentimes been a risk point. So I think we've got some opportunity there. It's the industry's got to take it up.
Great comments, Dr. Robbins. Hey, Guilherme, what do we have for Mycoplasma, pneumonia, and PCV2, influenza, anything in those areas?
Yes, for PCV2 specifically, we have an increased activity in the age category of the windshield market. But however, the SDRS team, in partnership with some industry allies, we investigate the situation, what was going on. And it seems that this increased activity of PCV2 was correlated with vaccination and vaccination handling issues in the state of Iowa. And these, as a consequence, increase the number of PCV2 positive cases that we have in these 5 VDLs. And also the SDRS team will keep monitoring this case just to ensure there is just a local issue and not spreading to other states. And moving to Mycoplasma, we have an unexpected increase number of submissions of Mycoplasma in the end of January and in the month of February right now. Just to have an idea, we have weekly submissions of 40 or 45 submissions, and now we are having over 60 submissions per week of this pathogen. And some of our advisory member groups, they mentioned that some of the flows, where they have some instability with PRRS, they're having issues with Mycoplasma as well. And also, some of the production systems, for example, multipliers, they are changing the testing part. Instead of doing serological tests, they are doing more deep tracheal swabs. So that's why it's increasing the number of submissions and not having a lot of positive cases, but more monitoring, let's say.
So that brings a question when one could hypothesize that if there is increased testing, there's increased pathogen activity, and that's why it's increased testing. But like you said, Guilherme, the positivity remains relatively stable. So turning back to Rebecca here, can you share your thoughts and kind of strategy towards when you're testing for Mycoplasma? What are you looking for, and any clues on how to interpret this finding of increased submissions but kind of stable positivity?
Yeah, I think we have to highlight again, it's good to see that the positives haven't increased. So, Mycoplasma, fastidious bug, so we need that time frame, right? Especially if we're going to rely on serology. And, no doubt serology is problematic. It definitely has yielded us false positives. So like you said, the use of tracheal swabs has become more common, definitely to clear those false positives. But even when we've got a situation where we may not be able to use the serology with the power, with the confidence that we think we should, I think that's where you start to incorporate the tracheal swabbing. And, there's been a lot of emphasis on modernizing our surveillance sampling methods, right? There's been multiple papers being published and work in the area of the risk-based surveillance, as well as being able to pool the samples, so making it cost effective to do that PCR testing and get a more real-time look. You got to remember though, surveillance approaches, period, are good for herds. They don't always work well for individuals, and that's where I feel like we get a little hung up. So we've got in most of our multiplication herds, we've also got the low prevalence situation as well. So not really good for interpreting, a positive. There's not a very good positive predictive value in those low prevalence situations, even for the tests with great sensitivity. So keep all those things in mind, I think, as we're, applying a testing approach, and we'll continue to monitor to see if this is a abbreviated period where we're seeing an increase in submissions, or it continues.
From what you can see and hear and participate, are the big systems projects towards mycoplasma elimination still going on and still solid?
Yeah, I think people have several reasons, right? We have, if you're most gilts available these days are negative. So unless you want to turn them positive, which is possible, I've shared that method with folks to you can acclimate them safely. But you've got to have a place to do that, and again, because the bug, you need some time to be able to do it. And so I think that more and more people are looking at the benefits, and Daniel, you and Dr. Yeski have published on this as well. There's economic benefit to getting rid of this bug, even if you still have other endemics in place. So I think that those are the two reasons that we're going to continue to see the industry work intensively on mycoplasma.
Great comments. Thank you for sharing that, Dr. Robbins. Hey, Guilherme, anything else from the SDRS?
Yeah, like moving to the influenza right now, that we are having a decreased activity in February, but this is expected for this pathogen in this period of the year. But however, we would like to remind our audience that the spring months are coming, and historically, we are expecting to have an increased detection of this pathogen in the spring. So get prepared for the influenza that might be increasing the next months in terms of activity. And moving to the confirmed tissue diagnosis, there are the submissions of tissue to the ISU VDL that the diagnosticians assign a diagnostic code based on clinical signs and also historical findings and histological lesions. We are monitoring that even though we are having fewer cases, we have an increase in the number of cases of confirmed tissue diagnosis of Delta coronavirus, coccidiosis, Trupelella pyogenes, and also Lawsonia intracellularis during January and February. So this kind of ends our findings from the SDRS, but I would like to move to our last question to our guest, Dr. Robbins, that in the advisory group discussions, Dr. Robbins, you mentioned some of the situations that you use the SDRS data for your daily tasks, for example, informing producers and other veterinarians about pathogen activity. So could you share a little bit with our audience, how do you use the SDRS data for animal health decisions?
Yeah, it's a great report to have when you're having discussions with people in a region or maybe across multiple states. We used to have to pick up the phone and spend quite a bit of time and then sort through, the quality of those phone calls and the information you were getting. Now it's right here at our fingertips in these dashboards. So that's wonderful. Recently, I've incorporated some screenshots from the dashboards to add into outbreak investigations that I've shared with producers, and to be able for them to have discussions around what their risk is in an area during that period of time, so that they can have more awareness. Again, it makes that idea of finding out what your regional risk is a lot more efficient when you've got those dashboards. You also highlighted having the etiologic diagnostic summaries, which are a fantastic addition, because with surveillance testing, we're focusing on detection. It doesn't always mean disease, and when you've got those etiologic summaries, you can really talk with people about what's meaningful out there causing mortality, and even pick up some of these what may be one-off increases in things like PCVAD, which is a difficult disease to monitor for with just a PCR surveillance plan. So it's great to have been incorporated those into the report and the dashboards. So keep up the great work, guys. I think that this is a wonderful service we have in the U.S., definitely unique to for our industry, and I think it'll continue to make us better.
That's great, Dr. Robbins. Thank you for that. And I would like to remind our audience that to have access to these dashboards that Dr. Robbins are mentioning, you just can go to the SDRS website and check this dashboard. They are available for everyone, not only the advisory group members, but also our audience that is interested to see this kind of activity.
And how they can do if they want to receive the report in their email, Guilherme?
Yeah, if they want to receive the PDF files, you can just send an email to myself or any of the SDRS members here to enroll, and also the SDRS email that is sdrs@istate.edu.
Very good, guys. Thanks, Dr. Robbins, for your time. Thanks for participating on this discussion. Like you guys discussed, the SDRS, we're bringing this information, but it's very important to have the advisory group and you guys giving us the feedback on how you guys use the data and what improvements we can make, and that help us to drive and improve the project. And that was
back to the program.
Yeah, thank you. It's a pleasure to work with you guys, and really excited to see where we continue to progress as an industry.
Very good. That was it, guys. Thanks for listening to us and watching us on this episode. Very good. And see you guys next month. Thank you.
Thank you.
Thank you.
Thank you.